I'm going to present the biomechanical adaptations caused by impingement or overbreathing dorsal spinous process in the horse. In other words, kissing spines. The dorsal spinous process are the dorsal processes of each vertebra. The distance in between each dorsal spinous process on healthy horse should be between 5 to 7 millimeters. The decrease of this space causes kissing spines, like the picture we have here. A grade system in order to grade the anatomical changes on kissing spines has been developed by the Knox and Dyson 2011. These go from grade 1, where there is a narrowing of the interspinous space, to grade 4, where there is a severe case of overreading of the dorsal spinous process. Even though there is no correlation between the severity and the number of dorsal spinous process involved and the age of the horse, older horses are more likely to be affected. Kissing spines occur between thoracic vertebra number 13 and thoracic vertebra number 18. The reason for that is because anatomically this area has a longer dorsal spinous process and they are inclinated towards each other, predisposing the horse for kissing spines. Short-backed horses are more affected. This includes all the thoroughbreds. There is also a dynamical factor that predisposes the horses to have kissing spines, even though this vision has been studied on the biomechanics, on post-mortem studies and three-dimensional studies of the back on the treadmill. Findings were that this region does not have a greater flexion, extension, lateral bending, or axial rotation range of motion. Show jumping horses have been associated to have kissing spines. Zimmerman et al. 2012 found that 90% of flat horses and 85% of national hand horses were affected, while other disciplines had only affected 38 to 54%. The weight of the saddle and the rider has been found to increase the extension of the back, predisposing the dorsal spinous process to go closer together. Skilled riders should be able to position the neck and the head of the horse on a flexed position. The effect that this has on the horse's spine has been studied on the ridden and unridden horse. The findings in these studies were that the anterior part of the thoracic region was more extended, while the caudal and the lumbar region was more flexed. These changes were also seen on the radiography images, which would predispose the pathology. These studies also found that there was an increase of the asymmetry of the vertebral pattern and a decrease on the axial rotation at walk. Stride length was also affected, but only at walk, and it was seen as a shorter stride caused by a reduction of the hind limb protraction. The ground reaction forces were only changed on the picture number 2 and figure number 5. These were the only ones that the rider was able to shift the forces of the forelimb to the hind limb. More difference were seen on walk than on trot. The diagnosis is made based on the anatomical changes and the clinical findings on pain. Radiography and nuclear scintigraphy are the most commonly used for the anatomical changes. On the left, that is a radiography. This allows the assessment of the distance in between dorsal spinous process, as well as the it can be seen the remodeling on the caudal and cranial part of the dorsal spinous process. The nuclear scintigraphy evaluates the remodeling of the bone. Therefore, it can be ascertained if that's an old injury or it's active. The local anesthetic of pain can be used in order to know for sure that the origin of pain is the kissing spines and not any other pathology along the back. Even though kissing spine is the most common cause of back pain, there's also a lot of horses performing at high level that suffer from the pathology. Diagnosis imaging relationship with pain was studied first time for Jeffcott 1980 with radiography evaluation of the back, it was found that 33% of the horses with back pain were affected, while 34% of horses without back pain were also affected. Later on, Zimmerman et al. 2014 found that radiography and scintigraphy maxing grades were associated with clinical signs of pain. These percentages are closer from the studies on dissection of the back. The difference on the findings are likely to be caused by the advances on the diagnosis techniques along the years. Pain is often assessed by a subjective evaluation, even though there's some scales have been designed in the past in order to grade the pain. Thoracolumbar pain is often evaluated by the posture of the horse. Also, the palpation of the back muscle. This can either be a hardness of the longissimus muscle, or there can be a twitching fasciculation, or maybe could just be a lack of reaction. Laminas involves the hind limb laminas. This can be bilateral. Passive spinal range of motion can be assessed. The riders often mention that their horses is not performing as they expect. There's been either a reduction of the show jumping ability. Callback is very common. This is when the horse rocks or dips the back when they're being girthed or mounted. The kinematic adaptations of back pain were studied by Wenstad 2004, where they compare horses with back pain and horses without back pain. Main findings were that the flexion and extension and axial rotation range of motions were decreased, while the lateral bending was increased on the thoracic 13. At walk, there was no differences at trot. In addition, stride length was shortened again at walk and not at trot. Later on, Wenstad 2009 compared before and after an induction of back pain with the use of lactic acid on the left side of the longissimus muscles. Findings in this study were less consistent. They found that there was an increase on the range of motion on the back. The back was also more extended on the between thoracic 10 and thoracic 17, while it was more flexed on the lumbar area. Lateral bending had a decrease on the first day and a decrease on the data collections after. The direction of the bending changed over the days. Pelvis tilt was only affected 1 hour after, and it was tilt to the right, both walk and trot. No significant changes were found on the linear and temporal parameters. From the data of these two studies, we can conclude that as a consequence of back pain, the horses stiffen the backs, therefore the reduction of the range of motion. The reason why we find more differences at walk than at trot is because the back movements at walk are more passively, while in trot the back muscles are actively contracted in order to stiffen the back. Stops et al. 2010 found a multifidus muscle atrophy at the site of the injury. This could be caused by the changes on the kinematics on the onset of the injury, while the reason of the changes in the kinematic on the more chronic stages. Landmark 2004 found that horses with back problems were likely to be lame. In this study, the only limb kinematics evaluated that were significant was a slightly decrease of the stride length at walk, caused by a reduction of the protraction of the hind limb. Further studies with the ground reaction forces could be used in order to find a relationship with laminas and identify why cause laminas. The treatment available, first choice is always conservative treatment. This consists on rest, anti-inflammatory drugs, mesotherapy, acupuncture, and extracorporeal shockwave therapy are options. Surgical options have very good outcomes as well. Physiotherapy is very important as it's part of the conservative treatment, but it is part of the rehabilitation after the surgery intervention as well. Um, Programs using the equicore have been found to decrease the axial rotation and increase flexion extension and improve symmetry. Core strengthening exercises program on the ridden horse in not published study has been found to improve the symmetry on the stride pattern and improve the range of motion. To conclude with, there is no direct studies have been performed on the biomechanical adaptations of the overreading or impingement of the dorsal spinous process. On the other hand, back pain is a key factor of the diagnosis of the pathology. It could be assumed that the studies we discussed have similar outcomes of the horses with disease. Therefore, back pain increases back stiffness and asymmetry of the movement. I like to highlight that core strengthening programs seem to have effect of reduction of the biomechanical adaptations of pain.